to the knee joint. As you can see, there are 4 articulating bones here, starting with the femur, tibia, fibula, and patella. Now, there are a lot of ligaments surrounding the knee joint, and I'm going to go with the first one, which is green in color, the quadriceps tendon ligament. This is the most common ligament because it helps in that strengthening of the knee from a bent position to extension, which I'll show in a minute. And the quadriceps tendon ligament originates from the 4 quadriceps muscles, which I named them in a second, inserting at the patella, through the patella to the tibial surface. The other ligament, which is red in color here, we have is the patellar ligament, and this one originates at the superior pole of the patella, and it is comprised of the fibers of quadriceps coming from top to the sides, and both of them connect at the tibial tuberosity. Now, the patellar ligament originates, it actually joins with the quadriceps tendon and inserts at the tibial surface. Now, moving on the lateral side, we have is the LCL, which is lateral collateral ligament, colored in blue. And this one is originating at the lateral femoral condyle, inserting at the head of the fibula. On the other side, which is the MCL, colored in pink, which is the medial collateral ligament. And this one is originating at the medial femoral condyle to the surface of tibia tuberosity. Now, if you can see yellow in color, that's the meniscus. Meniscus acts as cushions. They are the shock absorbers. So they distribute the weight evenly within the knee. Now, I'm just going to deattach these ligaments so I can show you the 2 cruciate ligaments more clearly. As you can see, my knee is in extension. Now I'm going to go in flexion. Now when I'm in flexion, you can see the 2 cruciate ligaments. The orange is the anterior cruciate ligament, and the purple is the posterior cruciate ligament. Now, the anterior cruciate ligament originates at the anterolateral aspect of femoral condyle, inserting at the middle intercondylar area. We have the PCL, posterior collateral ligament, and this one originates at the lateral medial aspect of femoral condyle, inserting at the posterior aspect of tibia. As you can see, both of the cruciate ligaments here. Now, when I go from flexion to extension, the ACL is going to help for extension. Thanks to ACL, because of ACL, the knee can never go in hyperextension because it serves the attachment point here. So when I go more, the ACL is going to stop from hyperextending. When I go in flexion, the PCL is going to flex the knee. So ACL helps in that forward movement of the knee, and the PCL helps in that backward movement of the tibial. Now, ACL is the most common injury happens in athletes and everyone because this happens when there's a sudden twist. So maybe I'm running and then I just stop and just turn and go to the other way, or I'm landing a jump and I landed in a wrong way. And when we are in flexion to extension, the femur has to rotate 20 degrees laterally to lock that position, and that's how we start moving and walking. When it has to go from extension to flexion, then it has to medially rotate 20 degrees so it can unlock that position and it can go down. Now, the 4 muscles which we have here on the anterior side is the vastus intermedialis. On the medial side, we have rectus femoris, vastus medialis, and the vastus lateralis here. On the lateral side, we have the TFL, which is the tensor fasciae lata, the IT band, which is the iliotibial band. At the posterior side, we have is the hamstrings, and beneath that we have is the gastrocnemius. Thank you very much.